A patient comes in with unrestorable dentition, the workup, treatment, and the surgical case today on the open reduction. Welcome to the Open Reduction, the channel Oral and Maxillofacial Surgery. I'm Dr. Tom Bolton. I was looking at the content of the channel recently and I realized I don't have any extraction cases up yet. Extractions are the bread and butter of the specialty. So here's a full mouth extraction. All maxillary and mandibular teeth are going. This patient unfortunately presents with grossly carious teeth throughout her entire mouth and needs upper and lower complete dentures. The radiograph shows generalized caries and unrestorable teeth. She's not going to pursue implants at this time due to finances, so I'm going to get her set up for a maxillary and mandibular denture. The first step is going to be using the 15 blade and incising each individual papilla and within the sulcus of each tooth. This is the start of the full thickness mucoperiosteal flap I'll be elevating. I want to keep the trauma to the soft tissue at an absolute minimum. A good rule is be nice to the soft tissue and the patient will be nice to you. Next, the throat pack goes in. This throat pack is so important to prevent aspiration. Here's the 77R starting to free up the periodontal ligament. And now I'm introducing the straight forceps, my go-to in the anterior maxilla to remove the roots of these grossly carious teeth. These teeth are coming out in one segment each, and I'm getting a nice grip below the mucosa without damaging the underlying bone. Once the forceps is on the teeth, I give it a slight mesial twist that breaks the ligament and prevents damage to the alveolar bone. I'm happy with the way this case is going. The teeth are coming out appropriately. The roots on tooth number 3 are independent of each other, so I'll be removing them one at a time. This mesial buccal root is not cooperating. It keeps breaking every time I put the forceps on it. So I'm going with a new approach. I'll use the periosteal elevator to get a purchase point and then tease it out that way. Since that worked, I'm going to tease out the palatal root the same way. I'm going to palpate the entire time to make sure there's no bony projections, no sharp bone spicules, so that the denture fits comfortably. Now that the right side's done, I'm going to move the bite block and start working on the left maxilla. This side's a little trickier because some of the roots are buried underneath the mucosa, so I'm going to lay a full thickness flap and identify and remove the roots this way. It's easy for these little roots to hide under the mucosa. Here I am peeling back this flap, and lo and behold, another root emerges.
The canine has a long root and it's easy to break the buccal plate if I'm not careful.
I want to preserve as much alveolar bone as possible without having any undercuts so that she has an excellent platform to hold her denture in place.
Now I'm going to use a bone file to smooth the edges. I use a lot of irrigation on these cases. The maxilla is looking really good. I don't have any undercuts, everything's hemostatic. It's time to close this. I always start by closing the midline first. I like to close long spans with a running interlocking suture. This is a great technique. It's much more efficient than interrupted sutures, and I still get a really nice closure. Everything has come together really nicely. Time to move to the mandible. I'm going to start with the same incisions along the papilla and the sulcus of each individual tooth to begin laying the flap. There are some teeth hiding under this mucosa as well. The new throat pack goes in. In full mouth extractions, I'm able to elevate the teeth off of each other. This minimizes trauma to the bone and mucosa. I'm able to free up these teeth with the elevator to the point where there's not much effort with the forceps. They come right out. This is the ash forceps, my go-to in the anterior mandible. The alveolar housing in the anterior mandible is so thin, I need to be very careful not to break anything. Sometimes it's unavoidable. Thankfully, in this case, everything held strong. I love the cow horn forceps for posterior mandibular teeth. This is a perfect example of why a throat pack is so important. This gold crown unexpectedly pops off, and it could go anywhere, but with the throat pack, it lands safely, and I'm able to retrieve it. cow horn drops into the furcation and gets an excellent grip. With the ash forceps, I'm going to get the last remaining holdout on the left side.
Now that I have the teeth out, the real work begins, reshaping the bone in order to make sure that the denture fits well. In full mouth extraction cases like this, it usually takes longer to prepare the bone for the denture than it does to take the teeth out. This is a crucial step so that the patient can wear her dentures comfortably.
Now that the left mandible is complete, it's time to jump to the right side and finish up. Number 29 is being surprisingly stubborn. I'm going to need the handpiece for this one. I'm going to use the burr along the mesial aspect of number 29 to create a purchase point and to remove the tooth without disturbing the buccal and lingual walls. The cow horn grabs the last tooth. Now that all of the teeth are out, it's more filing and smoothing bone to create a nice ridge for the denture. Same thing as on top, I'm going to reapproximate the midline first.
On big cases like this, I spend more time reshaping bone and suturing than I do removing the teeth.
The mandibular soft tissue has also come together very well. I'm going to trim some excess papilla, and then we'll be good.
I'm really happy with the way these arches look. There's adequate bone to support a maxillary and mandibular denture. There's no undercuts or sharp bony projections. She'll be able to wear her denture very comfortably. Thanks so much for watching. Please subscribe to the channel. Check out more oral and maxillofacial surgery cases. I'm Dr. Tom Bolton. I'll catch you next time on The Open Reduction.